Welcome to the USMLE Step 2 Clinical Skills Examination. This video will be shown to you on the day of the exam as part of the orientation session before the exam begins. The Clinical Skills, or CS component of Step 2, assesses whether an individual can demonstrate fundamental clinical skills essential to safe and effective patient care under supervision. These clinical skills include taking a relevant medical history, performing an appropriate physical examination, communicating effectively with the patient, clearly and accurately documenting the findings and diagnostic hypothesis from the clinical encounter, and ordering appropriate initial diagnostic studies. You must bring your scheduling permit, confirmation notice, and an unexpired government-issued form of identification, such as a current driver's license or passport. If you do not bring acceptable identification, you will not be admitted to take the test. Wear comfortable professional clothing and a white laboratory or clinic coat. The only equipment you are permitted to bring is a standard stethoscope. If you forget to bring a laboratory coat or stethoscope, one will be provided. However, the number of coats and stethoscopes available at each center is limited, and it is recommended that you bring your own. At this time, you will be provided with a clipboard, scrap paper for taking notes, and a pen. Personal items. The examination center contains a locked storage area with small open cubicles, as well as an orientation room with chairs and tables. You will be able to place personal items that you might need during the exam or during breaks at your seat in the orientation room. You will need to keep your identification, cash, or one credit card with you at all times. The proctors will ask you to check all your pockets, including your pants or skirt, shirt, and lab coat inside and out, to ensure that you do not have any unauthorized items. The proctors will ask you to put all unauthorized items in the storage cubicles. You may not keep cameras, recorders, examination notes of any kind, anywhere, reading material, PDAs, watches, cell phones, beepers, and medical equipment other than a standard stethoscope without digital amplification, electronic, or any other enhancement in the orientation area. Items such as these are not allowed to be used at any time during the exam, including breaks. They must be placed in the locked storage area and remain there until the end of the exam. Failure to place unauthorized items in the storage area will be considered to be intentional. Possession of unauthorized items will be considered irregular behavior, and these items will be confiscated. If a personal item you might need during breaks is in the storage area, for example, a toothbrush, medicine, or food, please take it out and put it on the table where you are sitting. The storage area will be locked, and you will not have access to it even during breaks until the exam is over. Your last opportunity to visit the storage area will follow this video. On-site orientation. The orientation session will include time for you to try out the diagnostic equipment available to you in the examination rooms. You are responsible for knowing how to use the equipment. It is strongly encouraged that you familiarize yourself with the equipment during the orientation. The exam. The complete exam process takes approximately 8 hours and includes 12 patient encounters. During the exam, you will be provided a light meal during the 30-minute break after the 5th encounter. You will also have a 15-minute break after the 9th encounter. Discussion of the cases or the exams is not permitted during these breaks or at any other time during or after the examination. Each Step 2 Clinical Skills Testing Center simulates a large medical clinic. It has 24 fully equipped examination rooms. In the course of the examination, you will go through 12 exam rooms and you will encounter a different standardized patient portraying a different case in each room. Each encounter begins with the examinee instruction sheet, which is posted on the exam room door. A copy of the examinee instruction sheet is also available inside the exam room. It includes information about the patient in that room: name, age, gender, and the reason for coming to see the doctor today. It also includes vital signs, which you should accept as accurate, and which you may repeat if you feel the case warrants that confirmation. However, if you do repeat the vital signs, continue to consider the vital signs as originally listed when developing your differential diagnosis and workup plan. All announcements are made over the public address system. This is an automated system that maintains the official timing of the exam. After the proctors place you in front of your exam room door and give the control room the signal to begin, you will hear a faint announcement coming from inside the exam room that will say,
SPs, please prepare.
There will be a 30-second delay, and then you will hear the announcement,
Examinees, you may begin your first patient encounter.
This is your first opportunity to review the examinee instructions and to write on your scrap paper. Do not slide the examinee instruction panel, and do not begin writing until you hear the announcement to begin the encounter. You will be permitted 15 minutes for each patient encounter, starting with the announcement to begin the encounter. Once you're through reading the instruction sheet, simply knock on the door and enter to see the standardized patient. You may introduce yourself however you wish. For most of the 12 cases that you will see, the standardized patient will be in a gown on the examination table. In some cases, however, the standardized patient may be sitting in a chair. The standardized patient will remain in role throughout the entire encounter. Please do not attempt to communicate with the standardized patients outside of their patient roles. Telephone patient encounters. You may have a case in which your interaction is conducted by means of telephone. In these cases, there is no standardized patient in the room, and data gathering will not involve a physical examination. If you have a phone case, follow these instructions. Press the speaker button above the yellow dot on the phone to place the call. To end the call, press the speaker button above the yellow dot. Do not touch any buttons on the phone until you are ready to end the call. Touching any buttons may disconnect you. Only one call is permitted. When you hang up, you cannot call back.
Hi, Mr. Peterson.
Again, a physical examination is not possible in this format. However, for these cases, as for all others, you will have relevant information and will be able to take a history and ask questions. As with the other cases, you will be given 15 minutes for the encounter with the caregiver and 10 minutes to record the patient note. Because no physical examination is possible for telephone cases, leave that section of the patient note blank. Patient encounters. Your time with each patient is limited, so concentrate your history questions on the patient's chief complaint using the general history as necessary. Perform the physical exam maneuvers exactly as you would for a real patient, respecting their comfort and modesty as you do so. The female patients will be wearing bras, which you may ask them to loosen or move if necessary for proper examination. Be prepared to find positive physical findings and accept any simulated physical findings as real. The following physical exam maneuvers are not allowed during this exam. Do not perform rectal examinations, internal pelvic exams, genital or genitourinary examinations, including inguinal hernia exams, female breast examinations, by which we mean palpation of breast tissue or nipple, or corneal reflex examinations. Any of these maneuvers may be ordered as part of the diagnostic workup if you feel they are indicated. Do not swab the standardized patient's throat for a throat culture. This can be ordered on the patient note as part of the diagnostic workup. All other examination maneuvers are completely acceptable, including femoral pulse exams, inguinal node exams, back exams, and axillary exams. Postural vital signs may be done if you feel the case warrants it, but you should not use your findings when developing your differential diagnosis or workup plan. Continue to use the vital sign information on the examination instruction sheet. Keep in mind that the standardized patients are subjected to repeated abdominal exams. Avoid very forceful or deep palpation. You will still be able to obtain the information you need without being unnecessarily forceful in palpating, percussing, or carrying out any of the physical exam maneuvers.